Welcome back and Happy New Year. If you didn't notice, we have a new schedule in the new year. We are now live every Tuesday, Wednesday, and Thursday at 9 a.m. PST. New shows, lots of new things we're going to be doing this year, lots of great new guests. So make sure you check us out on Tuesday, Wednesdays, and Thursdays. I can't believe it's already 2022. I hope you all had a restful and safe holiday. I know that many of you did, but I also know many of you didn't because if you're like me, you probably know someone that has COVID or had COVID. It seems like everybody, all my friends, all my family members have been infected with this virus. And if you're one of the hundreds of thousands of people that also contracted it during the holidays, I know that they weren't so bright, which is why we're starting the new year with a whole show dedicated to coronavirus, Omicron, vaccines, boosters, CDC guidelines, everything you need to know. We're here this morning to separate fact from fiction, and we have some of the best experts in the country to help us do so. So everything you need to know to keep yourself, your family, and your community safe is going on and happening this morning. All coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
It's almost 2 years after we started reporting on coronavirus in March of 2020, and today, January 2022, it feels like things are worse than they were even in the early days of 2020. Now, of course, the death rate isn't as high, but due to the new Omicron variant, it seems like everyone has COVID. From family members in Los Angeles to those in Chicago, St. Louis, and friends around the country, the report is COVID, COVID, COVID. And if my anecdotal stories aren't enough to convince you that we are at a crisis level, just look at the data from Johns Hopkins Medical Center that reports that more than 400,000 new cases are being logged pretty much every day. And they say that's a undercount because there are folks who are testing at home that are not even being counted. Now, even though cases are rising, with the exception of some states, we aren't seeing the high level of hospitalizations. But that's not true in places like Maryland, Ohio, and New Jersey that are seeing their hospitalizations rise as quickly as they're seeing their case count rise. Many are asking, with Omicron so pervasive, is this what the doctor ordered in terms of us getting to that place where Omicron or the coronavirus becomes endemic? We're asking that question this morning of some of the nation's leading experts, and here to help us start out our first panel discussion is Dr. Medell Briggs. She is an emergency room physician. She's Chief of Health Equity, Diversity, and Inclusion at UCLA Hospitals right here in Los Angeles. Good morning, Dr. Briggs, and thanks for joining me. You and I had a chance to talk last week. We were talking about this very same subject, and it seems like we just can't talk about it enough because it's dominating the news media. And as I said in my opening, pretty much every family member, every friend I talk to either has COVID or has been exposed. So help us understand, why are so many people this year, this period, being infected with the virus?
Well, thank you, Areva, and such a pleasure to be back with you. And good morning to everyone. So one of the reasons why so many people are being infected is the different type of virus we're dealing with right now. To take a step back, COVID-19 is a coronavirus. Now, coronaviruses have been around forever, but it just so happened again that this coronavirus became COVID-19 and due to just its structure, which is why we've been in this pandemic. Now, what has been going on recently is that the Omicron variant, of course, that everyone knows came out of South Africa, has now spread across the entire globe. Now, what makes Omicron different from some of the other variants of COVID-19 that we've seen in the past is that it just had lots of various different mutations. And with these mutations, and by the way, every virus mutates. I just want to make sure that we're clear about that. Every virus mutates. But with all of these various different mutations, we've noticed that it is much more contagious than even some of the other strains that we have. And we're getting more and more information right hot off of the research press of why it may be more contagious. We think that this virus in particular tends to accumulate more in the nose and may not travel to other parts of the body as easily as some of the other variants. So of course, if it's in your nose, it's much easier to spray that virus out to others. And so that's why we're seeing this large increased number of people being infected, but we're not seeing the high rate of hospitalizations and deaths, especially amongst those that are vaccinated, that we have seen in the past with Delta and some of the other variants of COVID-19. So new variant, new way that it actually infects people, highly contagious, but at least right now there's other reasons why we're not seeing the death rate as high, but there are still people unfortunately dying from it.
And help us understand when you say highly contagious. Can you give us an example? Does that mean if you're walking down the aisle at a grocery store and someone next to you has this virus, as you said, in their nose, that you're susceptible to getting it? Or does it mean you have to be next to someone and they have to sneeze on you? What does, what's the practical definition of highly contagious?
So what we mean by highly contagious is that we know that COVID-19 is actually spread through aerosols, so from your nose, from your mouth. So if you are in close proximity, which is why we've always said be farther than 6 feet, but if you're in close proximity and someone's not wearing a mask and they actually breathe through their nose or cough on you, or even just normal aerosols from your mouth, then yes, you can be exposed to that, which increases your risk of getting the virus. Now, if everyone's wearing a mask, that definitely decreases because that spray of virus from the nose or from the mouth may not come as closely to you. But when we mean contagious, at least some of the most recent data coming out, and we're still learning a lot about Omicron, it's thought that each one person who is infected by Omicron can infect at least 2 others. And you can imagine how it can spread very quickly in that regard. And the other variants, we didn't see that high level of being contagious the way that we're seeing right now with Omicron.
Okay, that brings us to what's going to be the word of the year, was this endemicity.
Yes.
And help us understand what that means. Big word, not talked about before, but relevant in the context of Omicron and the virus. And help us understand how that's different as it relates to the flu, because that word comes up oftentimes in relationship to the flu.
Yes, so endemicity, or thinking about endemic, like when does a virus or some other type of microbe become endemic? And the way that I like to explain it is we're living with it. We're around it all the time. And it is just part of nature, the same way that we're part of nature. And so the reason why we think that COVID-19 is always going to be around in some form or fashion is, number one, coronaviruses are already all around. And we see the coronavirus normally causes the common cold that we've been seeing for a while. But now with COVID-19, we think that it's always just going to be around as part of our nature, that we are going to be exposed to it. Now, the question that we still have to find out is this going to be like the flu? So influenza virus, which causes the flu, is around us all the time, which is why we recommend a flu vaccine each and every single year to protect you from getting the flu. So what we're looking at now is COVID-19 going to be just like the flu, in which we may have to get COVID shots in addition to our flu shots every single year to protect us and build up our immunity against it. But we're still waiting to see. But the way that the virus is acting right now, we think that it's going to soon just be part of what we see in our standard day-to-day nature. And then we will have to either figure out ways to protect ourselves if we're seeing those high rates of hospitalizations or deaths, or I'm hoping it becomes just like all the other coronaviruses that we already exist, and it just causes common flu or cold-like symptoms, and we don't have to actually have boosters against it, but only time will tell.
So I saw an article that said the way we should think about endemicity in relationship to the flu versus COVID is that the flu, one person infects one person. So that's why they call it endemic. Whereas they're saying COVID-19 right now, one person can infect multiple people. And so that's why it's not considered quote unquote endemic at this point. Is that an accurate way to think about this?
That is a way to think about it. I'm not quite sure that we're to that point yet from a lot of our leading experts. There's still a lot of discussion because even still with the flu, it's not only one person to one person. One person can definitely infect more than one person when it comes to the flu. And we absolutely think right now with COVID that one person can infect multiple people too. So the jury's still out. We still have to figure out a lot more information about where we're going with that. So I would just say that we just have to wait and see. And in probably the next couple of weeks to a month, we'll probably have a much clearer idea of where we're leading.
So, Dr. Briggs, what about the experts who are saying Omicron is a gift? This is the best thing that could have happened. Let everybody get, infected with it, and then we get to that herd immunity, and we pretty much solve the problem of the pandemic. Is that how experts like yourself and folks at UCLA are thinking about this?
Well, that is another way of thinking about it. And the reason why there is a thought behind this is that we know that Omicron is not as fatal as some of the other variants. And in addition, some of the new research that's come out is that not only does Omicron potentially not cause as much damage, especially to the lungs, which leads to some of the complications we've seen with COVID-19 in the past, but those that are vaccinated and or those that have had COVID in the past, we may have an increase in our immune system, not only just our antibodies, but a set of cells called T cells, which are another part of our immune system that may be able to recognize Omicron and actually get rid of it even faster than some of the other variants. So the thought of this is that if everyone's exposed, potentially then we have antibodies, our immune systems are much stronger to it. And so whether you're vaccinated or you get it, then hopefully we can just sort of kill this virus so we won't have to continue to go months and years with having COVID-19 around. So there's a lot of different thoughts to that. And we hope that we can actually get rid of this virus. But then others, we still know that still Omicron and other variants of COVID are still killing people, especially if you are not vaccinated, which we're still having concerns about.
But that's really confusing, Dr. Briggs, because I'm sitting here thinking, when you have kids, if one kid in the class had chickenpox, the theory used to be, bring all the kids together, let all the kids get chickenpox. So should those of us who have been fortunate enough not to have COVID, should we purposely expose ourselves to people that have COVID under this theory that, Omicron is, I'll use in air quotes, mild, and our T cells and antibodies will, and those of us that are vaccinated and boosted will be fine. We'll get through it. And then we're kind of helping with this herd immunity concept.
So I would definitely not recommend purposefully trying to get COVID. And the reason why I would say that in particular is because although we're looking at our building up our immunity, and although we know that Omicron is not as fatal as some of the other variants, there are still potential long-term consequences of getting COVID. And so that's some of the things we don't talk about as much. A lot of times in the media, we're saying, are you hospitalized or are you dying? But there's a large percentage of people that have had COVID, and which we call the long haulers, that have had long-standing complications weeks and months after COVID. So we don't want to have any unnecessary exposures because we never know who's going to have some of those other complications from COVID or not. But what I think many experts are saying is that if this may be a way that we may be moving towards ending this pandemic, and the level of the contagiousness of this virus may help us to get there faster, but we still have to be safe, we still have to be responsible, we still have to mask, we still have to get vaccinated.
And I would imagine it's too early to know if people that have Omicron are going to have what we call long haul COVID.
You're correct.
It's just too soon.
It's too soon.
And
yes,
are
exactly.
you able in the medical community to know now when someone comes in and tests positive if they have the variant, the Delta variant or the Omicron variant? Are tests able to, determine between the two?
So some centers actually do that. They actually do take a look at the virus itself and code it to see which variant it is. Most locations are not doing that. We already know from all of our data from the CDC and other sources that this was about 2 weeks ago, was about a 73% of all cases are Omicron. I think now we're probably way past 80+% of all of our cases being Omicron. So we just already know that just based off of some of the initial data and the cases that were coming out and the way that it's spreading. So to your point, no, we do not know yet what any of the long-term consequences may be for some people that do actually catch Omicron.
I want to bring Kim Reed into the conversation. She's a good friend of mine from St. Louis, and she actually contracted COVID over the holidays. And I wanted her to come on because, like many people, she has what has been described as kind of mild symptoms. Good morning, Kim, and welcome.
Good morning, Areva. Thank you for having me.
So you sound like you got something going on there. So tell us, how are you feeling?
Today, you do hear that it varies from time to time. Sometimes my voice is okay, and then sometimes it comes back groggily like this. But I feel pretty good today.
Mm-hmm.
Each day is different.
Wow. Are you feeling exhaustion? We're hearing from some people just this feeling of so tired, like they walk from one bedroom to the other, to the kitchen or something. They're so tired.
Yes, the first couple of days I did feel like that. And then the next day, couple of days after that, I was fine. And then yesterday I was feeling my best. And then as I started to move around, then I started feeling tired again.
Do can you pinpoint where you think you might have contracted COVID, like who you were around, what you were doing?
I can't, because if I got that, if I got it on the week of Christmas, then it's really hard to tell, because I went into my office one day, then I went to the dentist the next day, and then after I left the dentist's office, I went back to work. And then a couple of days after that, I visited a couple of friends who had less than 10 people, but I was around people on Thursday, Friday, and Saturday. Mm-hmm. And then I started feeling bad on Saturday night.
Wow. You are vaccinated, right?
Yes, I have both shots. I had not had my booster yet.
Okay. Would you characterize how you're feeling as having mild symptoms, or do you think that's not an appropriate way to talk about how you feel?
So I feel like they are mild. But my first symptom was my body started aching. And then I developed a headache after that. My head was hurting pretty bad over on the right side. And then the next day I was had chills along with the body ache and the headache. And then the next day after that, I didn't have the headache anymore. However, I still felt sore and just was really fatigued.
So, Dr. Briggs, listening to Kim, how common is what she's describing? Is that what you're hearing, folks who are coming into the emergency room, or folks coming into your practice?
Absolutely. Kimberly's comments and symptoms are very, very common and typical of COVID. So the body aches, the headaches, sometimes people feel significant nausea, they may have vomiting, and just overall just being very fatigued. We also are still seeing a large amount of coughing and even some shortness of breath as well, and labored breathing with the Omicron variant of COVID right now.
And given Dr. Briggs what she described in terms of her movement leading up to her symptoms, is there any way for you as a medical practitioner to kind of pinpoint what day she might have contracted the virus?
It is so hard to tell. And because what we know already from just watching this virus, you can easily contract the virus anywhere from 2 to 5 days before you even start having symptoms. So it's very, very hard to tell. But in addition to that, which is what's challenging during these winter months, we have COVID-19, but we still have all the other viruses. So we still have a portion of influenza out there. We still have what we call our garden variety viruses that cause muscle aches, headaches and calming colds. So even when you come in to see, for instance, myself or my colleagues in the ER, if you go in to see your doctor, what we're testing for is not only COVID, but we're also testing for flu and just making sure to see if you have any of the other symptoms or viruses that can cause those types of symptoms.
Kim, did you ever lose your smell or taste? We heard a lot about that in the early days of COVID.
No, I didn't. And I actually had an appetite, but the cough was really, really hard.
Wow.
And then, Areva, I did, make the people that I was around aware of what happened. So everybody that got tested came back negative.
Have you tested since to see if you're negative now, or you haven't gone for an additional test?
No, I have. I'm still quarantined until Friday.
And are you following the 5-day quarantine or the 10-day quarantine?
The 10-day.
Help us, Dr. Briggs, understand what's going on with that, because there's a lot of confusion about these CDC guidelines. Someone like Kim, who tested positive, has some symptoms. Should she be isolated for 10 days or for 5 days?
So according to the current CDC guidelines, if you have symptoms, which Kim does have, of the body aches, she had the coughing, had the headaches, and you test positive, you absolutely need to isolate for a minimum of 5 days. And isolation means you're away from everyone, okay? Now, at the day 5, if you're feeling better, or if you have no symptoms whatsoever, then the thought is you can wear a mask around other people for up to those 5 days if you don't have any symptoms or your symptoms are resolving. And that excludes a fever. If you have a fever, you still have to be isolated for a total of 10 days. So those are some of the newest recommendations. And of course, they're very controversial. There's a lot of confusion, but the idea is if you test positive and you have no symptoms, or if you test positive on mild symptoms, you have to isolate for 5 days. At that 5-day mark, if you have no symptoms or if your symptoms are getting better, you have to wear a mask around others, but it's not that strict isolation at that point in time. But that excludes if you have a fever, you have to stay isolated.
So where are you, Kim? Are you at day 5, day 6? What day are you at now from the positive test?
Day 7.
Okay. And do you feel like you should be going around other people at day 7?
I do not. I do not feel like, and if someone felt the way that I felt right now, I would not want them to go around my parents at this time, even with a mask. My parents are 80 years old. They are both okay. I was with them on Christmas. So luckily they haven't felt bad, and they did have the booster. However, I wouldn't want anybody around them at this time.
And so that raises a question, Dr. Briggs. You say it's very controversial. We know that the Nurses Association and some other professional organizations came out pretty much like Kim, saying 5 days is not enough.
Mm-hmm.
What?
This is all, and there's been a lot of various different discussions, and also you've probably heard we've now been discussing testing from the CDC as well, that people start to test at day 5. And so from the data, the reason why the guidelines were set up the way they are right now is because, at least from the data that exists, the belief is that people tend to be the most infectious, meaning they can spread the virus 2 days before they develop symptoms, up to 3 days after they develop symptoms. So basically a total of about 5-day period before and then going into after. So the guidelines were set for saying after that 3-day mark, so if you wait and are isolated up into 5 days, the likelihood of being infectious and transmitting that virus decreases significantly. So that's where the basis of the guidelines are at this point. But of course, it's also balancing how people are feeling physically as well, in order to not only, making sure they feel comfortable around others, but they can also do all of their standard work that they may have to do. So this is something, it's a very, very active conversation throughout our country. It's a very active conversation throughout the world right now. Many other countries have moved towards similar guidelines as well. But this virus is something that we have to continue to watch and continue to see what's best for us as individuals, but also collectively for public health.
So what's striking me about Kim's case, Dr. Briggs, is she's saying each day is different. So she says one day she feels better, but then the next day she'll wake up and feel like maybe there's some regression happening. So how can you feel? So short of testing, how will she ever know that she's virus free?
So the interesting thing, Areva, which I was going to bring up, what we do know even with testing, which is why there haven't been additional guidelines coming out yet, after you test positive, you may still test positive for COVID up to a total of 3 months after your initial test. So that's why that testing still has not been officially placed in the CDC guidelines yet. And the reason why it's not necessarily that you have an active virus, but you may have what we call viral fragments. So small little pieces of virus, they're not infectious, but your test will still come up positive for almost up to 3 months or 12 weeks. And so this is something we've known about COVID-19 since almost the very beginning of the pandemic. So even going and trying to get a repeat test in 5 or 10 days, even if you feel great, it may still come up positive because you may have some of those small little fragments that the test is picking up.
Okay, well,
I know. I don't know. Even more confusion to this, huh?
so would you advise someone like Kim who's still having these off and on symptoms to get tested, or you say don't even bother?
I do not recommend to my patients to get retested until 12 weeks afterwards because of this positive testing we know that we get when we actually do test at that point in time. And It's not for everyone, but there is that chance of having that test be positive all the way up to 12 weeks.
Now, someone like Kim, can she get a booster? She says she wasn't boosted. What's the guidelines now for when she can get her booster, given that she may not have a negative COVID test for up to 12 weeks?
Yeah, so what we normally recommend for boosters, or even after you've had an infection with COVID, and let's say you weren't vaccinated, the good thing is that there's 2 different types of immunity. There's passive immunity, and then there's actually active immunity. Passive is actually when we kind of give you the vaccine and we force you to have an immune reaction. When you do get COVID, that's an active immunity because you've truly been exposed to that virus. So Kim now has more antibodies. Her immune system is up and running now in order to fight off any other forms of COVID. But what we do recommend is after all the symptoms have resolved and people feel better, normally around that 30-day mark, then that will tend to be a safe time to get the booster. Or if you still have to complete your vaccination series, you can get that then as well.
Kim, do you have any questions for Dr. Briggs? I mean, it seems a little confusing, but I guess you're going to wait 3 more days. What are you going to do in day 10?
I don't know. Like, I think that I will finally go out. I'm going to be masked up, but like things like I need to go to the store. Like I'm a little worried about that. Going back to the office, like I noticed that we are getting more notices that there are cases in the building. So now when I go back to work, is this something that I need to be worried about for some of my coworkers that may contract it? And now I'm in the vicinity with them. Am I going to get it again? So it's just
That's a great question, Dr. Briggs. Someone, are people getting COVID twice, 3, 4 times? We get the flu multiple times, not just once. So is that a possibility that Kim could go back to work in a building where other people are, testing positive and find herself back in the same situation?
So unfortunately, that's why I state it's so important to be responsible, wear a mask, be vaccinated, as well as social distance and wash your hands. Because we do know people can be reinfected by COVID. Normally, we don't see it within a 30-day period. We see it when the immune system gets weaker, meaning you don't have as many antibodies at that point in time. But we have seen where people are infected by COVID more than one time. And so that's why we still, even after you have COVID, or even when you are vaccinated, it's still around. And therefore, we still have to do our part to not only protect ourselves, but also to protect one another as well. So all the same rules still exist. In fact, even my boys who are 9 and 11, they're vaccinated. Right after they were vaccinated, they're like, "Woo, we don't have to wear masks." And I was like, no, no, no. It is the opposite. You still have to do everything the way that you did before you were vaccinated as well. So until we get out of the woods, and we're not fully out of the woods yet as a country, we still have to be as diligent as possible of protecting ourselves and each other.
And just final question for you, Dr. Briggs. We're still getting people, in addition to saying this is mild, so it's no big deal, people are still saying this is just the flu. Help us understand why COVID-19 is not the flu. And even the flu can be deadly, but COVID-19 is clearly more deadly and more dangerous than the flu.
Absolutely. So the flu caused by influenza kills people every single year. That's the whole point of us having the flu vaccine. But the flu has not killed as many people as what we have seen COVID kill. So the COVID is not the flu. And in addition to that, we know that COVID oftentimes does not discriminate at all. And so we have looked across the board, we've monitored the death rates, the hospitalizations, and there's no rhyme or reason to a lot of the things that we see with how COVID impacts certain people. And so what we do know is that the best way to protect yourself is by getting vaccinated, because what vaccines actually do is decrease, no matter who you are, the severity of the symptoms if you are infected by COVID. So you may still have some symptoms, but it decreases the severity of those symptoms significantly and helps to keep you out of the hospital and definitely helps to save your life.
Well, thank you so much, Dr. Briggs. We got to leave it there. Kim, we're glad you're getting better. Hopefully by day 10, you'll be up and ready to go back out. Make sure you're wearing your mask. I assume a N95, K95, whatever those, better protective masks are. We're seeing now the congressional doctor telling Congress people, get rid of those flimsy little masks they were wearing and bandanas and get some serious masks out there. So mask up, socially distance, wash your hands, and we're going to pray for you, girl, and hope you get better. Thank you for joining us. Thank you, Dr. Briggs. Great information as usual. Always a pleasure to see you. All right, guys, we're moving on. So much to learn about this variant, this virus. We have 2 of the special report team members who also caught COVID over the holidays, and both of them are having different experiences. So I want to ask our next set of experts what to make of these different experiences. John Moore is back. Dr. Moore, he's a virologist and vaccine expert at Cornell University Medical School, and he's joined this morning by Los Angeles-based pediatrician Dr. Monica Asnani. She's the owner of Miracle Mile Pediatrics. Good morning, Dr. Moore and Dr. Asnani.
Good morning.
Dr. Moore, let's start with you. One of our producers, young woman, she's only 25. She's out with COVID. She had the J&J vaccine, but she did not get a booster. And so she wants to ask you, her question to you is it safe for her to get another brand of vaccine, or should she just at this point get a booster after that 30-day period where she's no longer symptomatic from COVID?
Well, the recommendation from CDC, and it's agreed upon by everyone in my world, is to get an mRNA vaccine boost after J&J. You can get either, but the mRNA gives you stronger boosted immunity. So that's, for instance, my son was in exactly that situation. So was his fiance. They both got their boosts about 6 weeks ago. And despite that, they both got mild Omicron COVID over Christmas and missed our family get together. But they're fine. They fully recovered because they had 2 vaccine doses and are young and had a mild infection.
Are we seeing more cases with people who had the J&J versus those that had Pfizer or Moderna? Is there any research out on that?
Yeah, it's not a stronger vaccine. The second dose of J&J, or the second dose of a vaccine for J&J people certainly makes a difference. The 1 dose is just not as good. So the mRNA vaccines are stronger, better, longer lasting. But if you were J&J, you certainly need to get a second dose.
And Dr. Asnani, you are pediatrician dealing with kids, obviously. And we're hearing so much about our kids who are now being infected. And, there's this scare that a lot of parents have, or fear that parents have about sending their kids back to school in January, knowing how transmissible Omicron is. What's your recommendation to your parents who are calling or coming into your office expressing those fears?
Right, Areva, thank you for having me. This is a very real fear for parents, and the fundamental reason why is that the younger children, 5 and under, cannot be vaccinated. And we've heard from Dr. Briggs and Dr. Moore, we've heard over and over that one of the best ways to protect yourself against COVID-19 virus is to be vaccinated, which unfortunately so far, the kids under 5 years old cannot be vaccinated. So yes, the parents of the preschoolers and the kindergartners and the toddlers are very, very concerned. We're waiting to see what's happening with the elementary schools and the high schools in terms of going back virtually versus in person, how much testing they're going to do. Every school seems to be doing something slightly different. So it is a very, very big source of stress for our families right now.
My heart really goes out to kids. They've lost so much, Dr. Moore. They've lost educational, attainment, academics. They've lost sports. They've lost friendships and socialization. And some experts are saying kids shouldn't have to be the sacrificial lamb for these adults who refuse to get vaccinated, and that we should just let our kids go back to school. And one of the fears, I guess, was that if kids get the virus, they'd go home and give it to their elderly parents or grandparents. What are your thoughts about letting kids back into school, not holding them out even when there's an outbreak in the classroom, just letting them be exposed to it? Do you think that's the smart way to approach school?
Well, it seems to be what's going on a lot, and whether it's wise is such a societal complex question. It goes beyond viruses and vaccines and virology. It relates to the best educational opportunities for children and the psychological consequences. I don't think anyone has got a simple answer to this. I mean, kids are getting more and more sick with Omicron. I mean, I don't mean individually they're getting more and more sick, but more and more kids are getting sick. And it's not that Omicron is targeting kids with greater efficiency, it's just a numbers game. If you get more and more infections, the rare children who do suffer badly and go to hospital are going to be more often. So I'm sure my colleague here will say exactly the same thing, that there is much more examples of kids finishing up in hospital. So, it is relatively benign in children, but there are hundreds of children who've died of COVID in America over the last couple of years, and there unfortunately will be some more.
Dr. Asnani, LAUSD, in the second largest school district in the country, is requiring testing for students and staff before they return. Is that smart? Is that going to help, at least know, I guess, be able to tell people are positive and maybe have them sit out a week or so? Do you think that that's a smart way to go about it?
Right. I mean, all of these modalities, testing, vaccines, social distancing, masking, all of those are additive and are helpful. So the testing, it's not going to be foolproof. We've all heard stories of somebody who tested negative on a Tuesday. They got on a plane on a Wednesday, and by the time they reached their destination, they were feeling sick, and then they tested positive on a Thursday. We've all heard those cases, but the testing will be helpful. And what we've learned from this pandemic is that kids really suffer when they don't go to school. And you're absolutely right that we did sacrifice the health and the mental health of our children last year. But remember, last year in the lockdown was something very different than this year, because last year, the elderly and the immunocompromised that we wanted to protect were not vaccinated. And now they have the chance to be vaccinated. If you look at the statistics of the elderly, it's quite good. Their elderly are quite well vaccinated and boosted. And so if the children do go to school, and if they inadvertently get COVID, bring it to their family, we think it's much safer than it was last year. And so you have to weigh the risks versus the benefits. And the benefits to the children are huge to go back to school.
So Dr. Moore, talking about those adults who are protected, we know we're at about 64% of Americans who are fully vaxxed, which at this point is just the 2 shots or the 1 J&J, not the booster. And we know part of that had to do with mandates. We saw federal mandates, federal government mandates. We saw employer mandates, restaurants, Broadway. Now there's a push for, I think Dr. Fauci said just a week ago, we should think about domestic airlines and having mandates if you want to travel domestically. Do you think we need more mandates to push us up from that 64% maybe to, 75, 80%?
Yeah, sure. I'll come to that. I just wanted to add to a couple of comments that both Dr. Asnani and Dr. Briggs said. There is definitely a problem with rapid antigen tests and Omicron. Why there's a problem is still being discussed and investigated, but they are failing far too often for comfort.
So you're saying the tests have too many false...
There's too many false negatives. There are too many people with symptoms who are therefore likely to be infectious, who are testing negative on the rapid antigen tests.
And are these the tests that you test at home? Is that the rapid test you're talking about?
The rapid antigen, the rats, the ones we are supposed to, the only ones you can get access to. You can't get access to.
The ones that the government is buying like 500 billion of?
This is going to be an even worse of an issue. If you test positive on those tests, it means something. But if you test negative, particularly if you've got symptoms, follow the symptoms, because the tests are failing to pick up these early infections. And that gives people the sense of false security. And, this CDC 5-day guideline, it is the most controversial thing the CDC has done in my world. Lots of pushback, lots of people not happy with it in the hospital setting. And Delta is still around. I mean, everyone thinks Omicron. But Delta, which is a much more dangerous variant, hasn't gone away. It may go away, but it's still around. And some people may be symptomatic with Delta for much longer. So, there's still many uncertainties we need to all figure out here. But on the mandates issue, it's the only thing in the last several months that's pushed up in vaccination rates. That people have to face a choice between having their lives inconvenienced and getting vaccinated. And domestic travel, I mean, the Canadians have done that months ago. You want to get on a plane or an intercity train in Canada, you need to have vaccination certificates. Canadians can do it. We don't do it because the government is nervous about the social reaction, and the airlines don't like it because it will reduce ticket sales, and quite reasonably, it will put a lot of pressure on their staff. Imagine, we all know, we see the reports of disruption on planes and at the check-in desks. That can only get worse. But we've bottled this. I mean, in Europe, multiple European countries have introduced really stringent restrictions on what you can do if you're not vaccinated. You can't go to bars. The only shops you can go to in countries like Austria are grocery shops for essentials. You can't go shopping. And yet we don't do this. I mean, and again, it's the fear of the disruption. The Supreme Court is discussing the OSHA mandate next week. Let's see what happens there.
Yeah, and Dr. Asnani, you made a good analogy, as we were coming onto the show about Serena Williams and folks with COVID. I'd love for you to share that with the audience. I think it just hits home perfectly where we are at this point.
Sure. Areva, I saw a tweet recently, and the tweet read, both vaccinated and unvaccinated people can get COVID. And then a doctor wrote back and she said, both Serena Williams and I can play tennis.
Yeah.
And that really speaks to the difference of how the vaccine protects us versus if a person is unvaccinated. And that's what we're seeing with the hospitals are by and large filled with the unvaccinated adults, and now the unvaccinated, unable to be vaccinated children.
Such a great point. Dr. Asnani, what about those kids who can get vaccinated? Are you getting pushback from parents? We know there's this vaccine hesitancy amongst certain, demographics of adults. What are you seeing with parents of kids who, are eligible? And then those kids who are now eligible for the booster, are parents rushing to get their kids, vaccinated?
Right. So we have been giving the COVID-19 vaccine in our office for a couple of months now. And what we're seeing is the parents are pretty much split 1/3, 1/3, 1/3. And what I mean by that is 1/3 of the parents were knocking on our door saying, when can we get it? We want the vaccine for our children on the first day that it's available. Those people, they got their vaccines. Then the 1/3 said, absolutely not. Do not ever call me again. Take my name off your email list. I will never give this vaccine to my children. And then there's the 1/3 who are somewhere in between. They maybe want to get the vaccine, but they don't want to be in the first round. They want to kind of wait and see how everybody does. So those people have waited. It's been a couple of months, and many of them are now coming around, especially with now Omicron and how contagious it is. So we are getting more and more vaccinated, but our numbers are still woefully lower than the adults, and it really needs to pick up a little bit.
So, Dr. Asnani, you're a pediatrician, so you see babies when they're born in the hospital, day 2, day 3, they're in your office. And if you have a child that's gone to any public school across this country, you've had to, as a parent, bring that child into an office like yours, and that baby has gotten a ton of shots on that visit and multiple visits. When you talk to your parents and try to explain to them, you're already vaccinating your child with so many other vaccines. How do they justify singling out this vaccination versus those multiple vaccines that all of it? I have 3 kids, so I speak this from firsthand knowledge. All of those vaccines that kids get, even up to, I think my college age kids had to get a shot for something. How do parents justify the difference?
Right. So we have this thing called magical thinking, and it doesn't really make sense logically, but people really hold on to these beliefs. So we've heard all kinds of reasons. The COVID vaccine is too new. It hasn't been tested long enough. It hasn't been tested on too many people. I never got it when I was a kid. So the routine childhood vaccinations, a lot of parents are more comfortable because it's something they had when they were a child, and they quote unquote survive the vaccine. So they're comfortable giving it to their children, but they never got the COVID vaccine when they were young, obviously. So there are a lot of reasons, and it's the same thing as when people say, well, I don't need to get the COVID vaccine because I don't go anywhere. And then you say, well, did you go to the store? Oh yeah, I went to the store. Well, what did you do for Christmas? Well, I went to my parents for Christmas, but you still quote unquote don't go anywhere. So that's the magical thinking that I'm talking about, that we can't get through that idea.
Yeah, this is the disinformation on social media effect. It's where do you get your information? And there is so much disinformation around. It affects a good 30%, as you said, Dr. Asnani, of the adult population who watch Fox News, go on Facebook, read Marjorie Taylor Greene's Twitter feed before she was banned for disinformation. And it's so misleading to people. It creates this false impression that the vaccines kill people, which they certainly do not. And there's no easy way of dealing with this. How do you stop people getting their information from really unreliable sources that are dangerous? And it really tracks with Republican voting and watching Fox News. It's a terrible feature of this pandemic.
Yeah. No, excellent point, Dr. Moore. We've got to leave it there. Thank you so much for your insights. Thank you, Dr. Asnani, for joining us this morning. Always a pleasure to see you, Dr. Moore. We'll stay on this, obviously. Omicron's not going anywhere. And we'll see. Hopefully this will be the wake-up call, though, that parents need for themselves and for their kids to get them vaccinated. Again, Happy New Year to both of you. Thank you again.
Thank you all.
All right, we've talked a lot about policy. My next guest, Emily Gee, is Vice President for Health Policy at Center for American Progress. Good morning, Emily, and thank you for joining us this morning.
Morning, Areva.
In this segment, really talking about that policy, because Dr. Moore makes a very good point. He says, look, other countries, Canada, Australia, Austria, I think he said Austria and Canada, had very strict mandates from the beginning. And it worked in terms of getting folks vaccinated. What is the problem with the U.S. around vaccine mandates? We have car seat mandates. We have speeding limits mandates. We the government is involved in pretty much every aspect of our lives. So this notion that the government shouldn't tell us what to do, that's illogical, because you can't do anything without there being some government regulation, law, or, a mandate. So why are we dropping the ball on these mandates?
So unfortunately, we have 2 mandates that are coming up, but are tied up in courts. And I think it's important to think about these mandates. These are public safety measures, just like school vaccinations are, or the vaccinations that you were talking about your children getting before they went off to college. And particularly, I think the healthcare worker mandate is really crucial for ensuring that patients are safe and that we have a healthcare workforce that is, they're healthy and not in quarantine and able to take care of patients when they need care. The OSHA mandate, the one for workers at large firms, I think will also be crucial in getting people who have been either hesitant or just haven't had time or have been busy or have faced other barriers to getting vaccination, help them get them over that hump and get them vaccinated to protect coworkers and themselves.
What do you make of the domestic travel mandate? Do you think we should be moving in that direction and moving pretty quickly?
I do. I think that is a good tool the United States has to get people to get vaccinated, the best thing they can do for themselves, to protect themselves and their communities. And we should have a mandate for both international travel and for domestic travel as well.
And do you see anything, in the pipeline to suggest that we're moving in that direction? I was surprised to see Dr. Fauci say he thinks we should be considering it, but I haven't seen any other White House officials, say in any official capacity that that's on the table.
So I agree with Dr. Fauci that this needs to be something to be actively considered. This variant shows that we are, unprepared to both for the healthcare fallout and the economic fallout from a surge of cases, and we need to be doing everything we can, whether that's more vaccination mandates for travel, in doing everything we can to put mandates in place for healthcare workers and for large firms, but also taking other measures, like, for example, recommending that people upgrade their masks. Cloth masks, unfortunately, don't cut it. And we are still hearing from the CDC that cloth is acceptable. But the government should be recommending that people wear at least surgical masks, if not N95s or equivalents, and also make those widely available and even free to each household.
Yeah, I'm a little disturbed by that because we know the doctor for the Congress came out recently and told them stay home, that they should telework. And he also said that they should be wearing the surgical N95 mask, that they shouldn't wear the cloth mask. So if Congress people, they're no better than any of us. So if their doctor is saying wear N95, why is the CDC lagging in terms of its recommendation? Because you still see people wearing these flimsy bandanas and like scarves on their faces. Why do you think under the Biden CDC, we're not seeing, a more aggressive approach to these healthcare issues?
I think every American deserves access to the tools they need to help keep themselves and their families safe. That includes rapid tests, includes a vaccine, which we have, and it includes high quality masks. This would be a change in tune for the CDC. Early on in the pandemic, the government discouraged people from using medical grade masks because we had a severe shortage of PPE that was a dire shortage of that was needed by healthcare workers to be able to manage the flow of COVID patients early in 2020. Now we have sufficient manufacturing capacity, but we're not entirely using that. So what I would like to see is the government step up manufacturing of N95s and equivalents, make sure we have enough for everybody in the US, and even mail them to homes. I think people would get the message that they should upgrade their masks. And if one arrived in the mailbox, maybe perhaps along with some literature on why that's important to upgrade your mask and some rapid tests, make it easy and make it free for people to do the right thing.
But do you think we're not seeing those policies because of the partisan pushback, the Republican base that is still, many of whom don't believe the virus is real, many of whom are pushing back on vaccines and even wearing masks? Do you think the CDC is caving in to that kind of pressure?
So I don't know what discussions are going on at the CDC. It is clear, I think, to all of us who watch the news that unfortunately the pandemic has become politicized. But this is far more than a healthcare problem. I think the health of our economy, our jobs, our schools all depend on giving Americans the tools they need to protect themselves and, taking the pandemic seriously and ensuring that we're prepared for this wave and the next one too. I hope there's not, but nobody can say what's coming up next.
Are you concerned about these new CDC 10-day versus 5-day guidelines? Because you heard all the doctors this morning talk about how controversial they are. We've seen nurses union leaders come out, really trashing the guidelines, saying that they're being economically motivated. We're seeing people say that this was all because the big CEOs of the airlines couldn't find enough staff to keep planes in the air, so their profit was being impacted, that the guidelines are more about employers wanting people back in those jobs at 5 days versus the science and the health of the individuals. So what are your thoughts about that? Do you think this was more economics versus health?
I think this is a really difficult policy decision. Over Christmas, we saw hundreds of flights canceled because of insufficient staff for airlines. In my neighborhood, I see restaurants close and stores close because workers are either out sick or they're doing the right thing and staying home and quarantining. And I think schools will be facing problems where there simply aren't enough staff to stay open. That said, I think there are a few things that we can do to make the situation better. One is to ensure that people have rapid tests so that we can test out of quarantine instead of just assuming that at 5 days it's safe to go around.
You heard Dr. Moore say these rapid tests are still very flawed and have a high false negative rate. So he's skeptical about how effective these tests are going to be. And obviously that's a whole nother big issue because we see these long lines on testing. I'm running out of time, but I do want to ask you this one question. Unvaccinated people. We're trying everything, right? We're talking to them, we're begging, we're pleading, we're nudging, we're incentivizing with gifts and cash and all kinds of other things and mandates, obviously. But we are hearing hospitals and healthcare workers exasperated with the number of unvaccinated people that are pouring into hospitals who, are taking up lots of resources, but also are exposing healthcare workers. There's like 20% of healthcare workers are out themselves. Do you think we need to move towards a more aggressive policy towards these unvaccinated people who are making conscious choices, not because they have a medical condition, but because they're just making a conscious choice to buy into the misinformation, or for whatever personal reason, they refuse to get vaccinated. But yet, if they get sick, they go to the hospital and they take up resources. Do you think we need to have a policy that prevents unvaccinated people from jumping to the front of the line in hospitals? I don't know. I guess we can't deny them treatment altogether, but should we get more creative about how we treat unvaccinated people?
So in terms of healthcare, I believe healthcare is a right, and people who need healthcare should be able to get healthcare. That said, I think there's more that we can do to ensure people get vaccinated, whether that's continuing to make sure that vaccines are available and widely accessible out in the community, ensuring that there are clinics in areas where low vaccination rates, at pharmacies and community sites. The businesses and cities and states can do more to require vaccination for entertainment venues, for bars and restaurants like San Francisco and New York have done. We should be using all the tools that we have to ensure that people can access and do get vaccinated.
We've got to leave it there. And we thank you so much. Chicago, we can add to that list that's implemented a mandate for social gatherings, restaurants, bars, etc. I suspect we'll see more cities around the country doing that. And we'll be watching that Supreme Court case closely to see what the Supreme Court does. We know there's already Supreme Court precedent for government mandated vaccines. An early case in the early 1900s established the right for the government to implement mandates for vaccines if it is a public health crisis. And clearly today we are in the midst of a public health crisis. So hopefully this 6-3 majority won't figure out a way to reinforce the anti-vaxxers, but will figure out a way to affirm Supreme Court precedent and protect the majority of Americans who believe in vaccines, who've gotten vaccinated, and who want to keep themselves and their families safe. So again, thank you so much, Emily, for joining me this morning.
Thank you.
All right. I want to thank everyone for joining me for our first show back in the new year. I wish we were talking about something more positive, but on a positive note, we are bringing you facts and we are separating fact from fiction. As Dr. Moore has said, there's so much misinformation on the internet about COVID-19, about the Omicron variant, about vaccines and boosters. We want to make sure that you have a trusted source of information, and that's what we endeavor to do every day on the Special Report, is to bring you the best and the brightest experts who are studying and working and researching these issues on a daily basis so that you can feel updated and can feel knowledgeable and empowered to make decisions about yourself and about your family. Make sure you're sharing the show. Make sure you're spreading the word about our new schedule, Tuesday, Wednesday, Thursdays, live new shows, 9 a.m. PST on Facebook, on YouTube. You can catch us. We'll be right here again, making sure that you are informed and empowered in 2022. Some words to live by before I get out. We may have all come on different ships, but we're all in the same boat now. Yes. And that boat is called coronavirus. So no matter how you got here, you're all in this together. We're all in this together. We started the special report in late March 2020 talking about COVID. We promised to bring you the cold, hard facts to keep you safe and to separate fact from fiction. We've endeavored to do that, and we are grateful to all of our experts that have helped us do that. And today confirms, yes, COVID-19 is real, and people who are still saying it doesn't exist. Oh my God, tell them they are so wrong. Those folks who say vaccines don't work, tell them they are so wrong. Kim Reed, our guest today, is living proof. She's vaccinated, and yes, she is sick, but she is not in a hospital. She didn't have to go on life support, and it looks like she's going to make a full recovery. So folks who are vaccinated are getting COVID. There are breakthrough infections, no doubt. But as Dr. Asnani gave us that great example, yes, the vaccinated and unvaccinated get COVID, but just because we both may get it, those of us who are vaccinated and boosted are going to experience it differently. You are not Serena Williams just because you play tennis in your backyard. Please get vaccinated. Please get boosted. Please make sure your family is vaccinated and boosted. Take this seriously because, again, we are all in the same boat. Be safe out there. Wear your mask, a good mask. And remember, we're all in this together.